Ever pondered the intricacies of a medical condition called intussusception? This peculiar term refers to a rather serious condition where one segment of the intestine slides or telescopes into another, akin to the mechanism of a collapsible spyglass. Quite a curious visualization, isn't it? But the reality is far from amusing, as this condition can lead to a severe blockage in the intestine. Intussusception, despite its complex name, primarily targets the most innocent among us, infants and young children. Predominantly occurring in the small intestine, this condition presents itself through a trio of telltale symptoms: abdominal pain, vomiting, and a discernible abdominal mass. Now imagine the intestine as a busy highway. Intussusception is like an unexpected roadblock that halts the traffic of essential nutrients. Left unattended, this blockage can escalate into dire complications that demand immediate medical attention. How then, you may wonder, does one confirm a case of intussusception? The answer lies in the power of imaging. Ultrasound, a non-invasive and widely accessible tool, often plays the lead role in diagnosing this condition. Once the diagnosis is confirmed, the medical team springs into action. The first line of treatment typically involves a non-surgical procedure known as pneumatic or hydrostatic reduction. Picture it as a gentle push that attempts to correct the intestinal invagination, much like straightening a bent straw. But what happens when the non-surgical approach doesn't cut it? That's when surgery steps in. The procedure involves delicately unraveling the affected portion of the intestine and removing any damaged or necrotic tissue. The aim is always to relieve the blockage and restore the intestine to its normal function. Postoperative care is just as pivotal as the surgery itself. It involves vigilant monitoring for complications and ensuring a smooth recovery for the patient. In the grand scheme of intussusception, several key points demand attention. First, this condition is an intestinal blockage caused by one segment telescoping into another. Second, it primarily affects infants and young children, presenting symptoms like abdominal pain, vomiting, and a palpable abdominal mass. Third, diagnosis typically involves imaging tests like ultrasound. Fourth, treatment often starts with a non-surgical procedure, escalating to surgery when necessary. And finally, postoperative care is crucial to monitor for complications and aid recovery. So there you have it, a comprehensive overview of intussusception, from its curious name to its serious implications. Remember, early detection and intervention are the keys to a favorable outcome. After all, as they say, a stitch in time saves 9 lives.